NCLEX RN questions practice. Question 1. Set 1. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 2. Set 2. Which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 3. Set 3. A patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 4. Set 4. A patient is receiving vancomycin. The nurse notes redness on the face and neck. What should the nurse do? Stop the infusion immediately, slow the infusion rate, administer epinephrine, document as a normal finding. Red man syndrome is often caused by rapid infusion of vancomycin. Slowing the rate usually resolves it. Question 5. Set 5. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 6. Set 6. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 7. Set 7. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 8. Set 8. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 9. Set 9. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 10. Set 10. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 11. Set 11. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hemoptysis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 12. Set 12. Which insulin is considered rapid-acting? Lispro, NPH, Glargine, regular. Lispro, Humalog, is a rapid-acting insulin with an onset of 15 minutes. Question 13. Set 13. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 14. Set 14. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 15. Set 15. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 16. Set 16, a patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 17. Set 17, a child is admitted with tetralogy of Fallot. Which position helps during a tet spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 18. Set 18, a patient with alcohol withdrawal is tremulous and agitated. What medication is usually prescribed? Disulfiram, chlordiazepoxide, methadone, bupropion. Benzodiazepines like chlordiazepoxide, Librium, are used to manage alcohol withdrawal symptoms. Question 19. Set 19, which electrolyte imbalance is associated with Trousseau sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 20. Set 20, a patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain.